Cervical spondylosis is an arthritis of neck spine. It comes due to age-related wear and tear changes of the neck spine disc. Spine disc is a jelly kind of material located in between every single vertebra. They work as the shock absorbers, which means they can reduce the shock going through the spine. They make your spine more flexible to move.
The spine is made up by two components. The outermost layer called annulus fibrosus. This is the toughest layer. The innermost layer is the nucleus pulposus. This is jelly kind of material.
As disc dehydrate, it leads to arthritis to develop, including bony spur or osteophytes formation. The joint surface become irregular, and this process is called cervical spondylosis. Most of the people asking, does cervical spondylosis affect only old age group population? The answer is absolutely not. Anyone can develop cervical spondylosis. People who are straining their neck with their day-to-day activities have more possibilities to develop at the early age.
For an example, a person who is sitting for a whole day on a laptop, bending down the head or pulling the head forward, have more possibilities to develop the osteoarthritic changes in the neck at the early ages.
Complications of cervical spondylosis. As we discussed earlier, the disc loses its water content, there will be changes in the spine disc. After a point of time, the disc starts to break down. It cracks, and through that, the nucleus pulposus can bulge out. This is what we said, disc herniation. So the herniated or bulged disc can compress the nerve root which are coming out from your neck. This is what we said, cervical radiculopathy. To start a shoulder pain or the whole arm pain. On the level of disc herniation, the symptoms might vary. Upper cervical disc herniation or compression of the upper cervical nerves,
the symptoms more or less around the neck region. But when it comes to a lower cervical disc herniation, the symptoms around the shoulder blade and the pain radiate down to the arm till the fingers.
Reduce the early wear and tear changes of the neck spine. So make sure you are not straining your neck during your day-to-day activities. If you are a person who is using a lot of computer work or typing work, make sure you are keeping it with eye level. Static cervical exercises are the best way to strengthen the cervical muscles, which can deload your spine disc. To do that, you have to give an opposite force to the head and to try to stabilize the head without letting your arms to push it. And you have to hold it for 5 to 10 seconds, and you can repeat the same thing onto the other side. And to the backward, you can press forward, and then front, you can push back. Secondary complications of having a cervical spondylosis is your joints become too rigid. They become stiffer and stiffer. A point of time you start to lose your nice cervical curve. People who are having a very bad cervical spondylosis have a straight cervical spine instead of a nice curved cervical spine. Having a nice curved cervical spine is to increase the weight bearing ability of the spine. When you start to get a straight cervical spine, the spine gets compressed more, the symptoms become more and more. Except doing the cervical strengthening exercises, there is another way to manage the symptoms is to recreate the cervical curve. There are muscles in the cervical spine to maintain the cervical curve. If you can able to strengthen those muscles, you can develop the cervical curve gradually, which can eventually reduces your symptoms. To improve the cervical curvature, you can do an exercise called chin tuck. Here, you are going to tuck your chin to making a double chin. So there are a few muscles on the front starts to work, which pull your spine forward, which recreate your cervical curve.